While medical care can be covered in some instances, dental care often is not. And the solution for me was going across the border because they actually are sensitive to the needs of each individual. When I went there, I found that they had state-of-the-art equipment. I found that they sterilized their equipment, and they are very cognizant of cleanliness in the office. They were very sensitive with everything that they did and compassionate. They'll work with each person on an individual basis. For instance, if you need a payment plan, they'll work out a payment plan with you. If you need to pay by credit card, you can pay by credit card. If you want to pay cash, you can pay cash. You can do it however works for you, and they're flexible that way. But even more than all of that, payment aside, it's the compassion that they have for the individual. I'm a very nervous person. I'm also a very sensitive person. And I don't handle pain well at all. I want to make sure that I'm out of pain. And I was just absolutely amazed at how gentle they were. I was really astounded with the fact that they have a pharmacy right across the street from the dentist. It was what, $10 for the prescription? I was absolutely astounded because a prescription over here for pain relief like that can cost you hundreds without insurance. Then I felt perfectly safe. People are very friendly, and they're also very happy to have you there in their country, and they make you feel welcome. I didn't find that I even needed a passport. I have a driver's license, and I've got a birth certificate, and that's all my son had, and we were fine to get through. You don't have to know how to speak Spanish in order to get proper care down in Mexico. I don't have a real strong Spanish background at all. I think my kids speak more than I do. But I found that the staff was bilingual. They understood, and they were able to communicate with me just as well as here. They gave me the room that I needed to be comfortable as an individual, and I really, really appreciate that. And I'm so happy that I went. There's nothing like seeing that makes you a believer, and that's what I am, a believer. I would like to reach out to people that are struggling with dental care in this country. I would like to reach people that feel that they have no options, that are struggling with pain because they can't afford dental care. I'd like to reach out to people that don't have proper insurance and people that feel that they have no other option and no place to go except to wait for hours and hours and hours in an office that maybe they'll be seen and maybe they won't, and then to have their whole day wasted. Doesn't make any sense to me when they can just run over the border, get the work done, and be happy with the results and have teeth that are functional so that they can eat properly, and they would be able to carry on their lives and have their self-esteem intact instead of suffering for years with low self-esteem, not being able to eat the foods that they like, and not to be able to live the way a normal person should be able to live in this country. My name is Nadine Taranto. And I am not Mexican. I am not even Puerto Rican. My husband's from Italian descent, but I'm American. And I have absolutely no connection to Mexico, and I'm not paid for this advertisement either. I give permission to Dr. Mark to use this video in any way that he sees fit, and to help as many people as possible, as soon as possible,